man.
Absolutely happy to have you. So, Dr. Lozzi, why is it important to focus on the issues of bone and joint health for this month?
Well, if you're like me, that's someone that played sports and is getting older, I think it's just important to know that about half of all women and about a quarter of all men actually develop osteoarthritis or osteoporosis by the age of 50. The other thing to notice specifically is that women that are going through menopause, within that first 5 to 7 years, because of the changes in hormones, they can actually lose up to 20% of their bone density. You may ask, why does that matter? Because it can cause fractures, and that's what we're going to talk about going forward.
Absolutely, and of course there's a lot of problems that can come along with this, including of course the fact that, again, affecting anyone here, but what are some of the ways that people can prevent osteoporosis and related conditions?
Yeah, so I think one of the first things we've got to mention is that osteoarthritis is very different than osteoporosis. So osteoarthritis is that joint disorder, reduction in mobility, typically because you have cartilage breakdown. So cartilage is between your bones, it gets broken down, you have bone to bone, and it starts to hurt. This is opposed to osteoporosis, which is just a reduction in bone density. You actually lose mass of your bones, and that's when we get into the problems with fractures. So in terms of how do you prevent it, I think whether it's this conversation about osteoporosis or the next slide's conversation about osteoarthritis, the key things are stop smoking, right? If you can reduce smoking, that alone can reduce your risk dramatically in terms of osteoporosis and osteoarthritis. And then it's that top right, exercise. Now, if you have osteoporosis, people don't realize that every time you have low impact exercise, you're actually doing microfractures of your bones, and it helps them remodel and get stronger. If you're already having joint pain, also important to do exercise, but make sure it's low impact so you're not hurting yourself.
So if someone starts experiencing issues from osteoporosis or arthritis, how can they be treated and screened?
Yeah, so I like the hot and cold thing, right? So people a lot of times say, when do I do heat, when do I do cold? In an acute injury, early on in the first 2 weeks, you really want to do cold. You want to shrink in that tissue, shorten those blood vessels, and really sort of essentially freeze it down, right? And so you can reduce the pain and inflammation. Later on in the healing process, or if you're older and you start getting stiff, heat actually helps you loosen up. It helps loosen up the muscles, the joints, and you can actually feel a lot better just from hot and cold. And then when we think about screening, and we mentioned this before, but when you hit a certain age, probably about 50 to 55, you do want to get screened. And it's really simple. It's called a DEXA scan. They go in, measure your bone density, and there's this T-score that they give you. Once you know the T-score, we can really start to focus on who gets treated and how they get treated. There's a lot of different medications. At the end of the day, the take-home from this is talk to your physician, have that conversation with them, get screened. You want to avoid a broken hip. And one of the main reasons to avoid a broken hip, especially above 60, is that up to 50% of people a year after a hip fracture actually die from that. And so medications, don't focus on that. Focus on the conversation you're going to have with your physician. Do I need a bone reduction medication? Do I need a bone increasing medication? They'll do the right thing for you.
Absolutely, and so there are a lot of resources and upcoming events focused on this as well, right?
Yeah, so one of the things about this is a lot of information. It's actually interesting. We really have a plethora of orthopods, podiatrists, physical therapists across the city. Shout out to Dr. Natividad and Dr. Sapien, who have helped my son with things in the past. And coming up this Saturday, really important, is there's the 2025 Walk to Cure Arthritis. If you have the opportunity, go to Oscardic Park. It's a really important event. And if you have pain, talk to a physician about it.
All right, and so again, if you're interested in attending 2025 Walk to Cure Arthritis, will be in El Paso this Saturday, May 17th at 9 a.m. at Oscardic Park. All the details you can find over on our website, kvi.com. So, Dr. Lozzi, thank you very much for speaking with us today about this important set of medical issues.
Thank you very much.
All right, we'll be right back with more after the break.